So for today's settings, ano kay Ate Mervis? Ay.
Sira na itong electric pan yung palada. Ay, lobat lang.
Okay, so let's start. So, good day. I am Luana Joy Leite, first semester student at Notre Dame of the Crown College, College of Nursing. So today I'm going to perform my written demo about assessing the abdomen. So the equipment we need is stethoscope. So procedure and rationale: assess the client's physical and psychological aspect before and during examination. Rationale allows healthcare provider to gather complete data about the client's health status. So next is review the body areas to be examined. So rationale helps examiner to identify which part of the body is to be examined systematically. So ito po. Next is third, make a physical and environmental preparation before examination. Rationale, proper preparation of the environment, client and equipment ensures smooth physical examination with few interruptions, so let us assume we are conducting in an appropriate environment. So next procedure, gather and take the health history of the client. Rationale, to have a comparison with the previous illness and present health condition. So sir, may health history ka po ba ng sakit sa tiyan?
Wala naman po.
Thank you po. So next procedure, conduct physical assessment of the abdomen using the 4 skills in assessment, which is the inspection, auscultation, percussion, and palpation. So next procedure, we're going to inspection of the abdomen. So procedure, first, inspect the abdomen for skin integrity. Rationale, the normal findings: abdomen skin, uniform color. The abnormal finding is presence of rash or other lesions, tense, glistening skin. So sir, pwede po pakita sang damit po. Check na po natin. So next procedure, inspect the abdomen for contour and symmetry. Ask the client to take a deep breath and to hold it. Rationale, this makes an enlarged liver and spleen more obvious. So sir, inhale po sir, can you inhale? Exhale. Okay po, thank you po. So, if distension is present, measure the abdominal girth by placing a tape around the abdomen at the level of the umbilicus. So, the normal finding, it should be flat, rounded, convex, or scaphoid. No evidence of enlargement of liver or spleen, and it should be symmetric contour. So, the abnormal, distended evidence of enlargement of liver or spleen asymmetric contour. So, next procedure, observe abdominal movement associated with respiration, peristaltiasis, or aortic pulsation. So, the normal findings, symmetric movement caused by respiration. Abnormal findings, limited movement due to the pain or disease process. So, inhale sir, can you inhale? Exhale. Okay po. So, next procedure, observe the vascular system. The normal finding, no visible vascular pattern. So, the abnormal, dilated veins. So, sir, taas po natin ang yung ano. Let us assume that we are going to taas ang damit. So, next is auscultation of the abdomen. So, procedure, warm the hands and the stethoscope diaphragm, then auscultate the abdomen. Rationale, cold hands and a cold stethoscope may cause the client contract the abdominal muscles. So next procedure, ask when the client last ate. So sir, kailan po kayo huli kumain?
Hindi.
Okay po, sir. Ay, mga anong oras po, sir?
Around
Anong na po, sir?
mga 5 a.m.
5 a.m. So, rationale, shortly after or long after eating, bowel sounds may normally increase. Next procedure, place a diaphragm of the stethoscope in each of the 4 quadrants of the abdomen. Rationale, this is to assess all areas of the abdomen. So that's so, next procedure, listen for active vowel sounds. Rationale, audible vowel sounds consist of clicks and gurgles and 5 to 30 per minute. Occasional borborge moss may be heard. So the normal findings, abnormal findings, hypoactive vowel sounds and hyperactive vowel sounds. So next, we're going to percussion of the abdomen. So first procedure, percuss areas in each of the 4 quadrants. So sir. So the normal findings and abnormal, tympani over the stomach and gas-filled bowels and dullness. So the abnormal, dull sound. So next procedure, the palpation of the abdomen. So warm hand and perform light palpation first to detect areas of tenderness or muscles guarding. So the rationale of this is cold hands can elicit muscle tension and thus impede palpatory involution. So we go. So the normal findings of this is no tenderness, relax, abdomen with smooth consistent tension, and abnormal tenderness and hypersensitivity, superficial masses and localized areas of increased tension. So sir, wala naman kayong naramdaman na masakit?
Wala naman po, ma'am.
Thank you po. So next procedure, then perform deep pulsation to detect areas of tenderness or muscles guarding. Rationale, normal findings, no tenderness or relaxed abdomen with smooth, consistent tension. The abnormal is tenderness and hypersensitivity and localized areas of increased tension. So next procedure, palpate the bladder above the symphysis pubis to detect urinary detention. So rationale, the normal finding is no palpable and no distension. So the abnormal finding is palpable and distension. So Evaluation, making findings of health assessment and physical examination done on the client. Rationale, these are important data to convey to the physician to aid in diagnosis of the patient. And lastly is documentation. Record, document, and report any pertinent findings found during assessment to appropriate personnel. Rationale, this is to provide accurate data in the care of the client. So that is will be all to the assessment of abdomen.